Sierra Leone. They serve as the lead clinicians and administrators for multiple PHUs. But these CHOs generally are only trained to perform the medical responsibilities. They don't receive training to do the various administrative tasks that the role requires, such as shift planning, HR, and basic finance management. That is why the Ministry of Health and CDC tasked eHealth Africa and other partners to develop and implement the CHO Management and Leadership Training Program in Sierra Leone in June of 2016.
So back in early 2016, the CDC director at the time met with the president of Sierra Leone, and they came to a mutual agreement of some of the needs for the country at that time. And they both felt that training in public health leadership and management would be a critical need. And they decided, after a brief needs assessment was done, that CHOs would be an important group to focus the training on. The needs assessment also informed the specific topic areas under the broader umbrella of public health leadership and management. So that was sort of the origin of the course.
So the training modules cover about 10 to 12 different modules, and top on the list, I think I'll mention the quality improvement module, the health promotion activities, use of data for decision making, and many more others. And to date, we have trained 128 community health officers across 10 districts, and we are in the process of training 24 more CHOs from Kono and Tonkolili. So at the end of June 2019, we're expecting to have trained and graduated 152 CHOs. So going back to the modules that are covered in the training, I would like to mention the quality improvement project. The CHOs get to choose whether to improve hypertension screening or HIV screening. And we have observed a lot of success stories and positive impact.
Before this time, we used to have 15% of our clients coming to the facility for counseling and testing for HIV, but now it has been improved up to 80%. Community engagement has improved, health promotion activities, and we are also continuing at the facility. We got all these skills as a result of the quality improvement skills.
My project was on hypertension. I took the QI project on hypertension to raise the awareness of hypertension in my community. We held a series of community meetings to raise the awareness on hypertension, and it was successful. We screened a lot of patients, and so many hypertensive patients were detected and treated. And it was important for us because hypertension is a silent killer, and in screening we can reduce disability, because early detection of hypertension can reduce disability and death.
We have another good success story to share, and a case in point is Generite CAC, where a CHO screened for hypertension, and because of the improvements made in hypertension screening, it got the attention of the National Non-Communicable Disease Control Program of the Ministry of Health. And because of the initiative, as we speak now, the process of developing a national treatment guideline to ensure that the screening and management of hypertension, especially at the primary healthcare level, is standardized, has commenced. It's as a result of some of these initiatives that we have witnessed at the primary healthcare level.
And because of the quality of training in terms of content and its importance in our healthcare delivery, you've discovered that it's been very, very fruitful. All CHOs we invite do come, and they do participate throughout the training schedule.
And the design of the course too, I'll just add, was modeled after the field epidemiology training program. When we've seen FETP in many countries throughout the world, and it has a structure of a combination of classroom trainings with on-the-job field assignments that reinforce that classroom training to really instill those lessons to the trainees so that they can continue to use those skills in the long term and even cascade them to their colleagues.
The program is being designed in such a way that mentorship is a key aspect in the success of the program. By following CHOs in their facilities, we help to guide them so that what they have learned in the workshop should be implemented.
Quality of data is also one of the big issues. We have seen CHOs becoming more confident in analyzing or reviewing the data that is generated from their health facilities and be able to interpret and try to find meaning why the figures are as they are. And yeah, that's really motivating.
Through the data available after the ministerial assessment survey, analyzed and presented to the CHOs, they now clearly know which facility is lacking what and which has more. This is the power of data.
The collaboration between partners has been enormous. eHealth Africa, who happens to be the lead implementation team, we are able to actually coordinate all the logistic and administrative activities so that the program can be implemented successfully. For ICAP actually is more focused on health system strengthening. So as a result, they use the quality improvement model to actually see how they can improve the health outcome of some of the indicators we have in Sierra Leone. For Njala University, being that Njala University is an institution which actually train the community health officers at pre-service level, they were able to actually see how best they can incorporate the management and leadership training module into their routine curriculum, which they have in the university.
The curriculum has also been brought to Njala University. As a school, we have deliberated on that curriculum, and that one has been sent to Senate for approval, in which we are going to either make it as part of existing modules, or we are going to take it as a whole certificate course in the university. That one we have to deliberate later together with the school board, and it's going to be incorporated. That one is a matter of must that we have agreed now that it is going to be incorporated into the BSc curriculum. For the pre-service training, the student will now know about leadership and management before they go out to practice.
The CHO MLTP program came at the right time. We've been able to improve on our management and leadership skills. This came as a result of quality improvement tool which we are taught in the training. I want to say a very big appreciation, more specifically to eHealth Africa, CDC, they are the brain behind this project, and also MOHS, District Health Management Team, they are the one overseeing our activities in the district. We want to be thankful to all of you. We appreciate you all. Thank you very much.